Okay, so did you know that most cancers are actually not hereditary? So should you then have your genetics tested for cancer risk? Well, Devin Fendlay, the genetics counselor with Women's Care Florida, is back to answer that question and a lot more. Good morning. Good to see you again.
You as well. Thanks for having me back.
Yeah, so this is an interesting topic too, because obviously I think cancer affects so many people, and we always talk about preventing cancer. This is why I love that your team has a genetics counselor like yourself, because this question, I'd imagine, comes up a lot.
It does. You know, even though we know that the majority of cases, like you said, are not hereditary, when it is, those people are at a very high risk. And our goal is that if we can identify these people, we can do something about it. We can offer them increased screening.
So what is the kind of the first step then? I mean, is it somebody who has it in their family? These are the top priority ones that should be tested?
Definitely. So usually in these cases, we will see some type of family history. And some of the big risk factors are cancer under the age of 50, rare cancers such as ovarian, pancreatic, aggressive cancers, especially prostate cancer, or just several family members with cancer. So even if someone has a family history of breast cancer, all in their 70s, but in 3 or 4 family members, they still might want to consider testing.
Okay, sounds good. So what does it mean to actually carry this gene mutation? Like, what are we looking for? What are these tests looking for?
Yeah, so we all have genes in our body that tell us what color hair we're going to have, how our body is going to function. We have a couple dozen that are supposed to protect us from cancer. And we sometimes find that people have changes in these genes that they're born with that put them at high risk because that gene is not doing its job. It's not working properly.
So when you get these test results back, I mean, what is it typically? I mean, is it that you're positive on one certain level? I mean, what does that actually tell you, that you're just at a higher risk?
Correct. So if we find that someone's positive for a genetic mutation in one of these cancer genes, it tells you you're at high risk. It doesn't tell you you have cancer right now, and it doesn't tell you you definitely will get it, but it lets us know that we need to be more cautious with your screening.
Okay, and that's what I was going to ask. So what do you do with that information then at that point? I mean, are you just, do you tell your physician that and then you are watched more closely throughout the years?
Definitely. So the exact recommendations do depend on which gene comes back. But as a whole, increased screenings. So maybe getting colonoscopy more often than you would normally, or getting breast MRIs in addition to annual mammogram. Also, the option of preventative surgery. So some of these high-risk genes, women do choose to get their ovaries removed if they're at risk for ovarian cancer, or have a mastectomy to have their breasts removed.
Let's talk about real quick the BRCA1 and 2, because I felt like years ago this came out and it was all over the news, and I feel like a little bit more people do know about this now. You were telling me something, though, that I didn't realize. That maybe even if it was maybe 5 years ago you got tested, even further back, you may want to get tested again.
Definitely. So, BRCA1 and BRCA2 are the 2 most common hereditary causes of breast and ovarian cancer. However, we've identified a couple dozen genes now associated with different cancer syndromes. So if someone had testing in your family about 5 or 6 years ago, they may have only been tested for those 2 genes. And there still might be a chance they carry a change in a different gene that might have a high cancer risk.
So this is interesting. I want to make sure we kind of close with this affordability for this, because I think a lot of people assume, oh, I can't afford that, or that's going to be just way too much. What say you?
Yeah, I hear that all the time. People think, I have to pay $3,000, $4,000 for this, but it's actually very affordable. If you meet criteria for testing, which your healthcare provider or genetic counselor will help you assess, most patients pay under $100, and many pay $0 for this test.
Some insurance companies are paying for this. So I mean, it would be helpful to know.
Yes, definitely. If you meet criteria, most insurance companies are covering not just BRCA1 and BRCA2, but also additional genes, again, as long as you meet that criteria.
And you say there's other kind of programs and other things, too, to really try to make it affordable for people.
Absolutely. Even if someone maybe is on the cutoff where they don't quite meet criteria, there are out-of-pocket costs as low as $250, and a lot of patient assistance programs. So if you feel that you really need testing, or your doctor thinks that you need testing, we'll find a way to make that affordable for you.
Awesome. Now, we're going to put your contact information up. If someone is interested in this genetic testing, would they go through kind of your office, essentially, make an appointment with you?
So typically I would recommend they ask their OBGYN or primary care for a referral to genetic counselor. Or sometimes those physicians are comfortable ordering the testing themselves. So it'll depend on your specific case.
All right, well, we'll go ahead and put your contact information. There's the number, the website to check out as well. But again, I just love that the team there has somebody like you on staff, because I know it's so helpful, I think, for big picture. Thank you so much. We appreciate your time this morning.